Betrayal, trauma, and fear. I want to spend some time and talk about this with you because for the last 40 years of my life, I have sat across in my office with women and men who have experienced partner betrayal trauma. And the consequences of that they did not expect. These are oftentimes confident women, confident men, business owners, entrepreneurs, doctors, dentists, lawyers, professionals, stay-at-home moms, people from every walk of life, every religion, every color, every imaginable kind of combination of person over the 40 years that I've seen in my office that has been betrayed. And they didn't expect to have the symptom of fear. They didn't expect to be afraid that their life would be unknown, that their future spiritually, emotionally, financially, sexually would be unknown, that they would have to face questions of staying or leaving or risking staying if they're not getting better, or so much tenuousness that it can create this undercurrent of anxiety or fear that, if not identified, can get worse and worse. And when fear gets worse, there are consequences. Now, if you've not subscribed to our channel, you want to do that, hit the button and the box down there for the questions. Send your questions. We will answer them as soon as possible. Fear is real. Now, fear is an emotion. Fear is not a fact. You can walk down the street and all of a sudden a wave of fear can hit you for no reason. You see a person walking by and all of a sudden it might grip you. And when you get close to that person, it's not someone you ever need to be afraid of. That happens. That's normal stuff. But because fear is an emotion, it's stored in your fascia system, which is that stuff that's under your skin all over your body, holding things together. It's not stored in your brain. So sometimes the fear won't make any sense at all. Sometimes you'll be triggered. We have a great video called Triggered that can help you, especially if you're struggling with fear. Some of the ideas I'm talking about will be in that video, and you can download that. But when you have this wave of fear, how do you manage that? So let's talk about that first before we get into some of the thoughts. The emotion of fear is something that generally we don't really have, especially in Western society, unless you're walking down a dark alley and it's late at night. But when it hits you, it's real. And when you've been betrayed, it's more likely to hit you than you think. Even if you've been fearless your whole life, all of a sudden your footing is off. Your balance is off in every area of your life. And oftentimes you haven't told anybody. So you don't really sometimes have the support to lean on to get rebalanced. And I would strongly recommend, as we get to solutions, you get into one of our support groups by phone or get in our Facebook groups for partner betrayal trauma, because it's real. And you can steady yourself with other people. But this emotion is real. I'm going to give you a resource. And you're like, Dr. Weiss, you're talking about resources. Yes, because for the last 40 years, I've written almost 50 books, many videos, training, whole trainings, 45-hour trainings on partner betrayal trauma, sexual addiction, intimacy, anorexia. So I put solutions in something that you can get a hold of. Now, the book is called Emotional Fitness. Now, the reason I'm sharing that with you is because fear is an emotion. And I personally have 4 degrees, and no one taught me how to have a feeling. No one taught me how to identify a feeling, communicate a feeling, feel a feeling, or even be able to switch a feeling. And you can give yourself a skill. The skill is emotional fitness, where you can feel a feeling and then switch the feeling. And in emotional fitness, I teach you the grid of identifying the feeling, identifying an opposing feeling, communicating it, writing it down, speaking it, and then allowing yourself to feel the feeling. And in this case, you would feel fear. You'd feel it, and then you would expand it 15 seconds, 30 seconds, 45 seconds in a minute, so that you can expand fear. Because when fear hits you at 3, if you've practiced it at 7, it won't throw you out of kilter. You won't go into that really kind of scary place. You'll be like, oh, okay, this is fear. And then you learn how to switch it with the opposing feeling of calm, safe, secure, loved, whatever that opposite feeling is for you. You practice that feeling. the same thing, 15, 30, 45 in a minute, so that you can practice that feeling, and then you practice switching them back and forth. Fear, secure, fear, love, fear, hope, whatever it works for you. Because you have to train your fascia system to be able to switch, not your brain. So that's what you can do with fear if you are someone who's experienced partner betrayal trauma. Now, what about the thoughts? This is where it gets tricky, because your fears are not usually rational. So if you can write down your fear and write down 2 or 3 other responses, that would be great, because it'll get you out of the locking thought process that this is the only way to think, okay? If he leaves or she leaves, okay, you will be able to be okay, spiritually, emotionally, financially. Why is that true? Okay. Also, as I talked about earlier, having support really critical. Having resources on partner betrayal trauma, doing your own work is really, really important, because it will mitigate the fear. Okay. Understanding the PTSD symptom structures that most partners have who've been betrayed, whether they're male or female. And understanding that that trigger is just a trigger. And whether it's an external trigger, a meaning trigger, or there's about 4 types of triggers. Once you understand what they are, you can manage them. And really what I'm trying to do is give you hope. First, validate that you having these feelings of fear totally legit, part of the consequences of being shot by the trauma, not your fault, but it is your responsibility to heal. It is your responsibility to not medicate your fear. Don't get into alcohol or drugs or some other way of medicating, avoiding through work or avoiding through sleep. Don't feed into the symptoms of depression and things like that. Identify what you got going on so that you can be competent, like, okay, I've been shot. It's not the end of the world. It just means my world is different. And how can I pick up the pieces I need to and start moving forward without creating a friend of fear? You do not want to do that. It will take you way longer to heal. It will impact your family way more than if you were able to manage fear. Well, I hope this has been helpful. I just want to legitimize that your fear is legit, and you can feel it, expand it, and switch it. And I hope you get to do that. If you have a question about this, put it in the box. If you've not subscribed, we have so much help on this topic. You want to do that.